first of all, I'd like to welcome everybody. I'm Pat Price, I'm co-founder of the Global Coalition, and welcome. This meeting is really to establish a radiotherapy task force made up of all the global radiotherapy community, clinicians, physicians and physicists, professional bodies, industry, etc., to try and support the efforts from the international community to the oncology needs resulting from the sad conflict and also the refugee crisis. We will be recording the meeting and making it available on the website. Please use the chat function, and if you could perhaps put in the chat function to introduce yourselves and who are you, and then also comment during the meeting, because with so many I won't be able to get everybody in, but please do that. Because we really will be thinking afterwards about people's networks and things like that. Raise your hand if you want to speak, and I hopefully to get you in. And if speakers are speaking, perhaps as there's so much to get through, if you confine yourself just to a couple of minutes, and then we'll get through everybody. So just to introduce the Global Coalition, for those of you who don't know, we're a virtual multidisciplinary collaboration of all the radiotherapy community. We're focused on basically hoping to help the world create better access to quality radiotherapy equitably. It was formed in at the start of COVID, and just as that's improving now, we find ourselves in another crisis. So we were here to help. So to start with, we were asked by the Global Coalition, was approached by Professor Richard Sullivan, who's from the WHO Emergency Committee, and he wanted assistance initially in providing intelligence from the radiotherapy community about our networks, with the knowledge that within the crisis, still the radiotherapy is needed in 50% of cancer patients at some time, needed in 40% of cures, and it's a very important part of the cancer pathway that has been disrupted. And it's recognizing, Richard recognizes it has its own very specialized challenges. It's a highly specialized technical multidisciplinary workforce. There's fixed large equipment. It needs power, it needs IT. Patients need to travel to centers over several consecutive treatments, usually over weeks. So it has a huge set of very niche area, but really important challenges. So through the work of our partners and stakeholders, we have been able to advise initially Richard and the WHO over the last few weeks about some radiotherapy issues, and we had set up our website for that. Richard sends his apologies, as he's actually out there at the moment, and he indicated a few issues to date. Firstly, that there's obviously a substantial gap in the relief operation, as cancer services are not an immediate priority for aid agencies, as they're obviously the needs now of food and shelter. There is patients, refugees coming through. There's a significant lack of medical history accompanying patients across borders, and further work would be needed for that. And obviously for radiotherapy, that's important in terms of treatment interruptions, previous treatment, and those sorts of things. And the WHO at that time needed high resolution cancer intelligence about the situation on an ongoing basis, and felt it was important to be able to plan then for the short and medium term. So I understand the WHO is coordinating the overall medical response, but the oncology aspect is being run through the ECO ASCO special network, and they've had meetings to collate the cancer response, and this radiotherapy task force will be feeding directly into them. There have been meetings already from them, and we wanted in this meeting to hear from ECO ASCO special network, hear about the needs of Ukraine and surrounding countries, and then open the floor to just to open this discussion about what are the possible problems, solutions, how we can get the right people involved to think about short, medium and long-term solutions. So just to remind everybody, the meeting is being recorded. Please, we'll be keeping everybody on mute until they've asked to come through, and we want to hear from as many participants as we can to contribute, and then we'll follow up the meeting and include discussion notes in the chat. So first, it's a great pleasure to have Richard Price here, who's the ECO Head of Policy, to tell us about this really important special network he has. Richard, over to you.
Thank you very much, Pat, and thank you for organising the meeting as well, and for your time today. I'll try to keep it brief, but we wanted to share a bit of what we're doing and how organizations on the call today might be able to connect, but really as well, I'm also here to listen to the discussions and to better understand what the needs are from the radiation therapy point of view. So to say briefly about who the European Cancer Organization is, if any are not familiar, we are a multidisciplinary body bringing together 40 different member societies at the European and international level working in cancer care and for the purpose of improving outcomes for patients through multidisciplinarity. And following the invasion of Ukraine, I think like the rest of Europe, our board of directors were appalled by the scenes that were coming through and felt, like so many others, that we need to play a role in reducing suffering where we have a competence and an appropriate part to play in that. And so our organization, we are all about convening and facilitating the community, advocating, being a united voice, but also taking concrete actions and steps where the community ask us to do that. And we work very closely with a large number of patient organizations as well. And so we felt that this could be something that we could direct our attention to as well, to bringing together a network for action on behalf of the Ukrainian cancer patients. We have a template for that in the sense of we did something similar in respect of COVID-19's impact on cancer care as well. And we were delighted as well to very quickly establish an international partnership with ASCO, who we work very closely with on a range of matters. So there was a passion on both sides to get this up and running quickly. So in terms of initial goals and what we're trying to do, firstly, it's around collaboration and coordination, bringing information together. There's so many people doing really incredible work, taking cars down to the border to pick up patients or to get supplies into the country. But we want to try to help coordinate that information, what people are learning, and bring that to other people's attention. Very quickly, we were learning about the information gaps and the great need to address that as an early priority. And we've been working on that already over the past week. And advocacy work, we hear problems about bottlenecks, for example, in medical supply or in getting patients efficiently allocated to cancer centres that have capacity to take them. If there's a need to have a word with the European Union, with national governments, even in the United States or at the WHO level, we think our role as two international organisations can help that. And we're already talking a lot to those kinds of organisations about what we're doing and what people are telling us. And we fully expect the network to evolve over time. So the needs keep changing, and so will the role of the network. So on collaboration, of course, yes, I think I've covered this. I'll just move through these quickly. So you can see here, for example, a new information section of our website. We got something up early, which is a lot of translated materials into Ukrainian. If you arrive in Poland, if you arrive in Romania, Hungary, even now we're getting the Western countries to Ireland, Germany and elsewhere. What do you need to do? Who do you need to speak to? What information should you be showing to your doctor? We're trying to get that up as rapidly as possible, get as many countries covered as possible, and then we'll work on finessing the visuals and everything else as time goes on. And then I mentioned about advocating. This gives you a quick impression of who we have involved. The absolutely key spirit of this is inclusivity. Anyone can join. Simply email us at ukraine@europeancancer.org, and we'll be delighted to add you to our distribution list. We're sharing information, we're holding meetings, we're putting together subgroups where that's necessary to address things. So we really would like to have radiotherapy strongly amongst us, and so please do get involved, and I'll put more details into the chat. To cover really what's been happening over the last week, we've been meeting with many people from the countries involved, healthcare professionals, surgeons, medical oncologists, ministries, the patient groups, as I mentioned, doing incredible work. And really, I think there's a few headlines that you might pick out as common themes. Communication materials for patients, but also this access to medical history. And we're looking at what, if anything, we can try to do to improve this. But amongst them is really trying to get information into Ukraine that if you are on the move, if you are looking to enter a safe country, what the steps can be to make sure that you've got the information with you that you're going to need when you arrive, and helping as well those in the centres, receiving centres, to communicate with the patients about getting hold of those records if need be. We can imagine a growing need to help and support those in the surrounding countries already doing phenomenal work to receive as many as they are. But it's sad to say we might expect, unfortunately, the numbers to continue to increase as the situation continues. We've got to try and find ways to help those patients with transport, accommodation, care needs. People are coming with a certain amount of budget that they have available to move, but that budget can obviously not last forever, and that needs coordination, that needs attention. And other issues coming up include how can we improve the supply of medical equipment into the country, what's getting in the way of that. Ukraine itself has passed a lot of legislation, for example, and removed regulations to get things in. But on the European side, there are still some controls and barriers stopping the export that we want to interrogate and understand more. So early actions, we've created information hubs. We are working, for example, on aspects of medical shortages. So we've got a group of the network participants meeting together this week to see what the situation is, what each partner can play in improving supply of medicines, not only to Ukraine, but if there are problems in the surrounding countries, that we also get those quickly resolved. And we meeting regularly with our steering committee on future possible actions. So I think there's perhaps some work we can do to help with patients' allocation to places of care across Europe. We've circulated very recently a survey from WHO to try and collect more information of who might be able to receive, and we'll continue to promote cancer centres taking that kind of action. We'll enhance our information hub. We're looking at specialised tools to increase the communication ability between the many organisations acting in this space. We're developing and refining the key policy asks to the Commission, governments and WHO, some media liaison, and any other issues that are brought to our attention by network members. So as I say, very interested to hear today about the radiotherapy experience. You can find out more about our network at a meeting that ASCO will be holding this Friday. There's a link on the website, on the page here. I'll post it in the chat as well. But there you will hear from Richard Sullivan and many other of the key experts working with the WHO on a daily basis. And I'll finish with some calls to action. So please do join our network. There's no barriers to joining. All you need is to send an email to Ukraine@europeancancer.org. Spread the word to other people that you know may be able to usefully participate. Share any resources that you've got. Don't imagine that we necessarily know them already. Please post them to Ukraine@europeancancer.org. We want your ideas, your suggestions, and what you're hearing from different places so that we can record that and, if need be, take particular advocacy actions, for example, and keep in touch. And back to you, Pat, for the rest of the meeting.
Richard, that's brilliant, and such a good job you're doing. Absolutely fantastic. And it's really our job to sort of serve and support the efforts you're doing. So thank you very much. Okay, I think we haven't got, so I think the next one would, we were going to go over, next thing is to really understand the needs of Ukraine and surrounding countries. I think we have got some contributions from Ukraine.
My colleague, Alex Boychek, is from Ukraine. He's actually on the call. He's been more involved in getting sort of medical supplies to Ukraine, and we've been supporting him with that, but he'll obviously know a bit more of what's happening on the ground, I think. But we did have a recent cyber attack in Ireland where we had to very rapidly prioritise patients for treatment, and I suppose we have a lot of documentation. It was kind of, I suppose, a similar situation, just a national cyber attack where you're just trying to get people back on treatment very quickly. So we can share all of that with the group. I don't know, Alex, if you want to maybe comment more.
Don't feel shy. We're here to help.
We certainly, I suppose it's more straightforward for us in a way because, well, people can, once they arrive in Dublin Airport, they have access to healthcare straight away. And I think there would be a huge, people, there's a huge amount of goodwill there. And I think people really want to help. So I think that, it's just a case of, I suppose, identifying people in Ukraine that needs treatment, really.
Yeah, no, yeah, I think that's right. I was thinking, Electra and Varian, have you any comments on, because I know you've been talking to some of the actual centres in Ukraine from the supplier point of view, any intelligence you've got from there? Hi
everyone, this is Teresa from Varian. I'm very happy to welcome this discussion, and I know that we're all interested in understanding what more we can do. I can say that from Varian's perspective, we've compiled internal task force groups looking at the situation in Ukraine and understanding how this is going to be impacting neighboring countries during the refugee crisis that we're experiencing. From Varian's side, I'm happy to say that I've got colleagues from several different business units on the call with us, representing a legal perspective, the business itself, and then also from an IT and service perspective. So Varian itself does not have a presence directly in Ukraine. We have a distributor model, and so we've been getting information through our distributors. But we've been looking at some of the ways that we can access data, share data, understand how we do or don't have the legal right to use this kind of thing. So I'm happy that this conversation will help us understand what some of those issues are and how we can directly address them together. If any of my other colleagues from Varian would like to jump in and share how we've been working together, you're very welcome. I know I see Michael Milton, we've got Michelle Cook. You're all very welcome. However, I hope that this conversation can also provide an opportunity for colleagues in Russia to tell us about what they're experiencing.
Maybe if I could jump in.
Please, Michael,
Grace,
yeah.
Many thanks. Hello, everyone. My name is Michael Milton, Irish in Geneva. Just from the legal perspective, obviously, Richard, you touched on it, the accessing the medical history and clinical records of those arriving in the EU host countries. What we have to ensure is that the data is in a form that is acceptable to the EU host country. So what we need to focus on as a suggestion is ensuring that the relevant patient consent forms are available from Ukraine to accompany the medical history so that it's a seamless transition. And maybe, Aileen, you might have some, we were talking about the cyber attack in Ireland, perhaps with the arrival of patients, newly arrived patients, refugees, there might be some learnings there within the group that we can use already.
I mean, I think that there would be a lot of cases where you have to go back and re-image people and almost go back to the drawing board with the lack of information. I suppose one thing about patients from Eastern Europe, they do tend to carry a bit more information with them than, the average Irish patient. They often will come with lots of records, but I think there might be a bit of working it out, but perhaps kind of redoing some things quite quickly.
Yeah, no, that's great. Thanks. Yakov, I see you put your hand up.
Yeah. Good morning, everybody. Well, good afternoon, those in Europe. I have been involved with medical physics for war benefit for a number of years, and also with the International Organization of Medical Physics. And I'm aware that there is an organization of Ukrainian medical physicists. I've been trying to reach out to them and see if they have any input into this situation. But I would be particularly interested in if anybody knows how many if there are centers in radiation therapy that are operational. The Ukrainian Association of Medical Physicists published a map of the locations where there is cobalt units, linear accelerators, brachytherapy units of cobalt or iridium, and that probably was derived from the. I think it was derived from the IAEA database.
Yeah. Yeah, that you're right, it was that. We popped that on our website, and then that's very helpful in terms of the distribution where they are, really. That's really good. It would be really helpful to reach out in that respect, actually, because then get some more information and some help. Yeah.
I didn't get any reply from the organization, from the leaders of the organization, but I mean I don't know if they are in a position to reply or to answer questions right now. But does anybody know what proportion of facilities are still operating in Ukraine? If some of them are not, I mean that's probably an important piece of information if we want to get any records or any other information about patient treatments and so on.
Yes, I don't know if Electa had any more information, or Rolando, you wanted to come in there.
Yes, thank you. I was mentioning to you that I'm part of the group. We are two external experts who are not staff in WHO, but we are working with the WHO in a group that was created about 2 weeks ago to face the situation with regarding cancer. There is information about the number of centers who are operating, and the number of centers has been destroyed, the number of centers who are partially operated. Actually, in this moment, probably only 7 centers in the whole country are working. Right, but particularly in radiotherapy, I don't remember from those 7 centers how many of them are working. This group, I think that it will be good to connect this group with the WHO team, who's doing all the arrangement for trying to address the issue that is ongoing there in Ukraine.
Yeah, no, that's really helpful. Thank you for that. Alex, you've got your hand up there.
I'm a Ukrainian doctor working in Ireland for the last 20 years, but I don't have a direct contact with radiotherapy centers in Ukraine. I'm focusing on fundraising medical aid for emergency situation, but I can reach out, and I could be a link person if you wish. And I can translate whatever documents will arrive to anybody from radiotherapy perspective. There is no problem at all, because I can speak Ukrainian and Russian and so on. And so that's how I would like to contribute. At the moment, I don't think it's a priority, but it will become priority very quickly. And I think, as you correctly said it, we need to prepare and be ready. And I think establishing this structure and contacts would be very important. Yeah.
That's absolutely brilliant. And the language you say, specialists in technical radiotherapy, is really important. I noticed on the call, on the chat function as well, I see a lot of people have been saying at various places, somebody, a Romanian speaker, all this type of thing. I think that all sort of information is going to be really helpful. Can I just move on then to think about the surrounding countries? Obviously, Romania, Poland. I know we've got quite a few people from Poland. I know the pressure is on you there. Does anybody from Romania or Poland want to say anything? Can contribute how things are there?
Yeah, Piotr Wojcieszek. I'm a president of Polish Brachytherapy Society here in Poland. So we started to coordinate help for people, I think it was 4th day of the war. So we changed our website completely to only information in 3 languages, in Ukrainian, in Polish, and in English, with numbers to our center. But just after that, our National Health Fund just said that every Ukrainian patient will be refunded in Poland. So this helps very, very much. I think today we passed, or maybe yesterday, 2 million of refugees in Poland, mostly women, children, and elderly. And what my impression is that those people are not seeking oncological help on the first place, but there are a lot of people with diseases which are or injured casualties of war. So this is which is emergency. But to add, I know that in bigger cities like Warsaw, Krakow, Wrocław, Poznań, there are bigger diaspora of Ukrainians. So people were there for working. So they had flats, houses, and they were living there. So their families came to those cities. So my colleagues and friends from Krakow, for example, in National Cancer Institute, they treat now around 20 patients in each center. It was last week on I think Wednesday. So I think that the numbers are growing. Mostly these are patients during chemotherapies, but there are also, because there were no drugs in Ukraine during the war, during first weeks, and now I think there will be more and more patients for radiotherapy. However, there are a lot of informations in Polish internet on the National Health Fund, I think, National Institute of Cancer website, our website, and all other websites, Twitters, Facebooks, and so on. So I think that these patients will find help. However, there will be also patients going to Germany, France, and Western Europe. So this second and third waves will come there, and the language barrier will be bigger, because Ukrainian and Polish, we can try to understand each other. There are some Cyrillics, there's a Latin alphabet in Poland, but the older doctors know Cyrillics. So I see that my good friend from Greater Poland Cancer Center also write something on the chat. So there's a lot of information, and I think that this wave will come soon. So in next weeks.
That's really helpful. Do you think you'll reach capacity?
Excuse me, could you repeat the question?
Capacity. Do you think there'll be a point where the brachytherapy services in Poland won't be able to cope with the amount needed, or do you think you have enough capacity?
Yeah, we have capacity. We are ready for that. We always are. We are trying to work on the verge of capacity for every time in Poland. So yeah, we can do that also with radiation therapy. I think the bigger centers are ready to do that. So we got 10 Linux in Gliwice, so we can do that, and we can work like from morning till night. So it's not a problem.
Which is an amazing, because you must be all exhausted with COVID, and now you've got this. Good. Yeah. A hand up there under Therese. Good morning. Yes.
Yeah, I don't know why it keeps saying Teresa on my name. It's Michelle. Yeah, I just wanted to sort of say, yeah, thanks for the opportunity to come to this call. You know, as Teresa mentioned, we've been sort of working with our customers. We've got 27 Linux in Ukraine through our distributor, so we're in touch with the sites. Also, we're in touch with our managing director in Poland yesterday, who stated this is the same. You know, it's women, children. You know, it's critical about finding a place to live and to be safe. But there will be this need for treating patients, and you know, whether we can DICOM export treatment planning. You know, as Michael said, it's all about patient data and getting patients to agree the transfer of data. But the Polish centres do tend to work sort of 2 or 3 shifts anyway. They work sort of 12, 16 hours a day on their nights already. So they will come to a country in Poland eventually. Yeah. And we've had requests in from our distributor in Ukraine about parts and humanitarian equipment that we're sending through to get those machines running as much as we can. But clearly a very difficult situation within Ukraine and countries around. We're seeing patients coming over to Hungary as well. But it's the language barrier. And also I've been in touch with some of our colleagues there that the patients want to stay close. They want to stay close to the Ukraine. And, you know, for them, it's hard to, you know, I guess on one hand, they want to have their radiotherapy somewhere, but they don't want to go too far away. So the burden really is going to fall on the countries that are closest. But us, you know, as the manufacturers, the more that we can help in terms of being able to get the data out of these centres so that the treatment plans or the radiotherapy they've had can be utilised in other centres, and we will do. Data privacy is the hardest part here, and any work that we can do together to get some kind of special license to use the data under this sort of force majeure.
I think, and then we'll go on to a little bit about that, how we formalise it. Just finally, I think is there somebody from Romania on? Is it Ion from Romanian Varian?
Yes, hello.
Yes, tell us about Romania.
Yes, hopefully we have only 400,000 people that cross our border, which is not so many people, and I think the worst is to come, because all the people that are living now in Ukraine are the one who can walk, mainly healthy people. But I also expect cancer patient to be admitted in Romania. I know about private hospitals that already start to speak with hospitals in Ukraine, asking if they need help and providing this help, meaning transportation of patients from Ukraine to these centers and to continue the treatment. So okay. Romania is involved. So yeah. It's a private, from what I know, it's just private perspective. Yeah. I'm pretty sure that we can handle and help more.
Great. Well, it's great that everybody's experience. And if anybody else have got something, please put in the chat box. Please do get in touch, because we want to get it. And I know particularly people in Ukraine, if they can't speak today, do add. I wanted to move on to the next bit. There are some very specific questions that Richard wanted us to answer, and we probably can go use these in a sort of more general discussion just to finalize this last section of the meeting. I think as he can say, he wanted to know about the Ukrainian data, and Orlando, I know you seem to have got a hold of that, should be great for Rich and things, about radiotherapy planning and access of those, and obviously we've heard now about some solutions there, about the state of capacity, and also thinking through how easily that can be increased, and then thinking about how radiotherapy can be fed into increasing capacity. So I wonder whether we should get up the slide now, Darren. We've put some, and then to help this slide think about our next bit of thinking, it's almost there to sort of throw out sort of the problems, and then really to get everybody's input into thinking what could possibly be the solutions. So we're just having some initial thoughts throwing down. I think if we're talking about it'll be a capacity issue in some ways, won't it? In terms of if all the centres go down, or if Poland is overwhelmed. And I think that's related to machine capacity, IT infrastructure, on the ground workforce. We looked at, obviously the HERO data from ESTRO has done very well at showing us about the estimate of the number of cancer patients, and obviously those who could then need radiotherapy gives us an idea. We've got the COSIA data and all the other data about how many machines per million head of population. The workforce data is less easy to get. And then we just threw some ideas here about sort of short, medium and long-term solutions, what sort of government bodies can do in terms of organisation, or whether it's moving people or whatever, what industry can do, because obviously it's a highly technical subject, so industry will have some of the solutions here in terms of obviously supply, machines, parts, communication on the ground, whether they can access to take machine off. Also in terms of if there is a planning capacity issue in the future, is that the way that we can involve other parts of the world in terms of remote planning, assist in that way, open it up to other things. And then whether, again, professional bodies, great ideas here in terms of people who can translate and all those other things. So I think in terms of the short, medium and long terms, I think we could open up that discussion there. Therese, I see you've got your hand up. From Electa thinking, and also thinking about what are these issues and what things do we need to be thinking about and who needs to get involved? Tell us your thinking.
Yes, hi everyone, I'm Therese, and I'm also part of the GCR core team here, but from Electa. When we've been thinking about this and how to utilize GCR, we see the very need. I mean, radiotherapy is such a technical and complex treatment where you need, specialized workforce, you need the very high-tech equipment, and you need, obviously, the government also to support efforts and investments into radiotherapy, etc. So we thought with GCR, we actually have a very good setup to bring all parties together. And that's why we also saw the opportunity to have this meeting today, collecting the RT community. And we tried to sort it out like this. And we would really hope that we together could, work together and eventually have a structured plan, how we can come together, not working isolated, or because we need to work together. And from an industry perspective, since radiotherapy is such a high-tech, software-backed treatment today, we have a lot of capabilities to look into data that are in our machines. We can do remote service, we can have solutions for remote planning and all of that. And I think most of that is already existing. We can put it to play in a very good manner to increase capacity. Also to increase radiotherapy capabilities by having workforce remotely, to train remotely. And the good thing with COVID is that we have been pretty good, all of us, to develop these feature and to do a lot of things online and remote. And with that, I just wanted to hand over to my colleague, Dimitri, who's on the grounds in the Ukraine region to see what we actually have been able to do now and what eventually we can do moving forward. Dimitri.
Thank you, Teresa. Hello, everybody. Good to see some familiar faces on screen. Unfortunately, not for the right reasons, so to speak. I'd like to thank the GCR organization for taking the initiative here, because as probably all of us are aware, kind of after the initial shock, connections and kind of help started trickling down straight away to Ukraine and to people that need help, kind of following personal relationships that have been developing for a long time. So we are aware already of kind of quite a few patients being redirected either to Polish hospitals. I don't know if there is anybody from the National Cancer Institute here, or in Romania, or as far afield as the UK and Sweden, I hear. So now that we expect, of course, for more and more patients to make themselves known, both to their clinicians and where they are currently, for that number to increase. And this is where your efficient organization would come in to put everything in a kind of a more structured way. From what we hear at the moment, the priority from purely practical point of view is more on the pharma side. I'm sure our colleagues have the same experience, but we are aware and are helping technically and on the service side a number of sites that are still operating and treating intermittently in Ukraine. I saw Ruslan Zelensky, I think you are online, so maybe it would be better off than me talking about that. So yes, we are here for everybody. We've already set an organization in place to prioritize service, technical issues, as well as general help desk. And we do hope this will help.
No, thank you. That's really, really helpful, actually. I just wonder if I think somebody's from Astro's here, as the Americans here.
So thank you all for doing this. This is so important. We're actually just here to listen right now. We want to know what we can do, how we can activate our network. The American Cancer Society is doing a lot with the American Society of Clinical Oncology to kind of collect resources and send information out. One of the things they're doing is they're looking for a volunteer corps of folks to help translate information for patients that are looking for information. So we're trying to share that as widely as we can, and we'll do anything else that this group recommends. We want to be as helpful as we can.
That's brilliant, Jeff. Thank you. So summing up where we've got to, it sounds as though there are some very practical issues specifically for radiotherapy, which will be a combination of the societies and groups and industry to solve. And it's working through how we can best push this forward. Is there anything else anybody's thinking we haven't? Because we've addressed things like legal, cyber attacks, because it's very much IT based in equipment and getting equipment there. Is there anything we haven't added? We should. Some of the whys and great. Oh, Pietro again, thank you.
I have now one thought. So if there are 40 Linux and 20 Cobalt machines, and there are some Iridium sources or Cobalt sources, so if there's an attack of the hostile army, so if the Cobalt unit or Iridium unit is destroyed, so what about the radiation on site? Do you have any thoughts about that? Do we have any procedures?
Yes, that's something that Electa had done some work on for us with the IEAA in terms of also conscious of the cobalt sources, a lot of in Ukraine. Therese, did you want to tell us about the work you've done on that?
Oh, I am by no means an expert on cobalt. Electa, we do have a, cobalt in the gamma knife, which is not located in Ukraine, as I understand. But what, so maybe there is some radiation security protection expert on the call, please step up. But what I hear is that the equipment should be in pretty sturdy bunkers and protected quite good as initially. Will there be a direct hit? That might be something, but what I understand that is cobalt is a heavy substance that will come to the ground, and that also Ukraine and IEA is good of taking care of these kind of things. But maybe John here, you have a better understanding.
Yes, I can say a little bit because we actually have a cobalt unit in Kingston, one of the only places in North America that still has one. It's coming out next week or in 2 weeks. The unit itself would be relatively safe. It's the shielding and the structure of the unit, most units that I'm aware of would have very good integrity, and it would take a lot of work to try to expose a source. I don't think that would be something that would be directly a threat. So I wouldn't be too concerned about cobalt units at this stage. The security there most likely would be of good integrity. Fooling around with brachytherapy devices, if they're not as aware of what the machine is, it looks like a vacuum cleaner, that could be a little bit more of an issue. But I don't think this is the highest priority right now. My concern would be a little bit, patients that have been treated on these cobalt units will not have the extensive treatment plans, perhaps, that are we're more used to. So there's going to have to be some translation of what were perhaps some relatively simple plans, and perhaps palliative, I don't know, that are going to have to be translated. So it's not just going to be a record, record, and verify kind of thing and treatment plan. It's going to be, how do we modify these plans that might have been a little simpler than what we're used to seeing. And we're going to have to go back a little bit in techniques that we were using in our settings perhaps a while back.
Yeah, no, I agree. I must say it's 30 years ago we were treating on cobalt, so it's a long way. Somebody's put in the chat box about the depleted uranium in the head may be a challenge. But again, I think the IEA would usefully deal with all that. Agatha, could we bring you in? You've got your hand up.
Sorry, I just needed to step in because I put information into chat, but I have to support Piotr and actually disagree with John. Russians are already in Chernobyl. I don't think that cobalt unit in single department is an issue for them, and I don't think we can rely on security there. I think it's still a big threat, and I have no idea how to help with this issue, but I think we cannot, we shouldn't really underestimate that there is a radiation threat from cobalt sources and other sources of radiation. Thank you.
Teresa just put in there are 20 cobalt machines in Ukraine at the moment. So they would be a risk. Yeah, no, helpful. Important to go there. Can I bring other people? Mary, have you got Mary Gaspardarovich? Have you got some wise words for us? Sorry to jump on you, but.
Well, I think that first of all, make a list of everybody who's attending, because you have quite a large number of volunteers here who obviously want to engage. And then, you know, as Richard Sullivan said, make a plan. And I think the plan is, you know, what is the help needed on site in Ukraine and how we can help and who can we contact? How can we help the countries that have the biggest burden of refugees? What do they need? And then have a sort of list of centers that are willing to accept patients and have certain capacity. I think most of them will be in Europe, but you know, we already having sick kids in Toronto, a few children from Ukraine coming next week. So I think having sort of a segmented plan of how we want to engage and who wants to play with whom, because, you know, this network of European and ASCO has now a large number of organizations, and we can start tripping through each other rather than helping. So I think we need some structure and plan and what's the short term, medium term, and long term. But the most important thing is to find out who wants to play together or help each other. Thanks.
No, thanks for that. Richard, could I bring you in there now? What's your thinking on Mary's comments there?
Well, there is work underway by the WHO to try to get more of a register really of cancer centres who have capacity. I can certainly maybe share the document. Unfortunately, it's not a sort of online thing at the moment. It's more of a request that goes out by email, but we're working with them on seeing how we can link them up more with the cancer centres. But that's definitely an area that I think we can do, and also if people are able to join the network either as individuals or as societies, then certainly on our part we can build that radiology community, but of course working with GCR, Astro, and others in whatever ways felt to be appropriate.
No, thank you.
So you, sorry, just a clarification. So you think the best way is to join the ECHO ASCO network, right?
That's one way we can help linking up with the WHO efforts. Because
yes, certainly we've joined the, certainly the GCR is part of that effort. I think, Mary, that was the thinking, and Richard's thinking that was the way through there. But as you say, I'm conscious there's some specialist stuff in radiotherapy, isn't it? Richard, does that come over to you, that there is some very niche sort of...
Yeah, I hadn't heard the cobalt radiation risk before, for example, and but I've been following the chat as well there on some of the solutions, because we hear the problems and we're trying to identify solutions, but some of the, you know, for example, the rapid documentation, the remote planning, these are things that we can bring forward to the next meeting of the steering group.
Yeah, no, good. Really good contributions. Therese now, and then I just want to bring in Advamed. Therese.
Yeah, I just wanted to share, as Michael from Varian's legal team mentioned, we've been looking at a lot of the data issues involved in sharing planning processes and this kind of thing. So with that, he's been working on getting a draft of a consent form that would cover both data protection issues as well as medical confidentiality. And so this is being put together in Ukrainian, and we're just waiting on an official English translation of that. But I would like to then share that with this group and see if anyone representing the most likely host countries in this scenario, so Poland, Romania, Hungary, etc., are able to look at seeing if this document covers the data protection issues of those countries. And if not, we can see what other sort of wording can be added so that this can be something that we can then share so that a patient could present at a hospital, say, I was treated at hospital X, and I'm now seeking treatment, so that it would be a hospital-to-hospital agreement that would allow Varian, Electa, whomever, to then share that data, but covering everyone's bases to make sure that we are fully protecting their rights as well.
Yes, I suppose that's a way, because you can get the data from the machines electronically. That's a big plus. As I was saying, Richard, a lot of this is, there are some IT solutions to this, if we can do it, which is good. AdvaMed, Shandi is here from AdvaMed in terms of representing a lot of the manufacturing organisations. Shandi, what's your thinking in terms of how can globally, you know, industry in terms of that help, linking with the diagnostics as well?
So I think, apologize for my voice, but I think that one of the primary things that we can bring to the table is that we do represent the majority of medical technology companies around the world, both in and out of radiation oncology, which will allow us to quickly convene together and find consensus among industry, and also find the right folks when needed, including those diagnostics. And we also have additional oncology companies beyond RT and diagnostics. So I think we have, you know, quite a quick response to gathering industry to get all of, you know, the IT together and that sort of thing. So and also to find consensus among industry as needed. So I think, you know, just moving quickly, we have a broader Ukrainian response team. We've been putting together resources, both business-wise, but also in response to the humanitarian crisis. So we continue to work on those, again, both within radiation oncology and beyond.
Oh, thank you. Right, okay, well, I think it's been really helpful. I think I'd draw it to a close now, because it's been hugely helpful. And thank you everybody for coming on the call. I think this has been really good to just air a lot of these views and think about what would be needed for a radiotherapy specialist task force. We will, as I say, we've recorded the meeting. Please carry on the chat. We'll be sending this out and trying to, we've got the website on the GCR as well, trying to find a mechanism of most efficiently getting all those, you know, radiotherapy community links together in a wide spiel. It may be that then we should have another meeting like this in another few weeks as things change and develop. And also we'll be feeding into the ASCO ECHO specialist group. And also I'll be having a meeting with Richard in a couple of days when he's back. So I think unless anybody's got anything else to say, I want to thank everybody, and everybody in Ukraine and the surrounding areas keep safe, and hopefully the global radiotherapy community can help and do what we can to make things better and better for the future. Okay, thank you everybody for joining.